Knee pain when trying to sit back on your heels? Well, today I'm going to show you a way you can improve that. Surprisingly, a lot of times the way to improve a movement is to actually do the opposite movement. To do that, today we're going to talk about directional preference. Directional preference is trying to move a joint into its end range of motion in order to restore mobility as well as to reduce pain. The example we're going to use today is the knee, obviously. This, however, can be done with any joint of the body. For the knee, since we're talking about knee pain with flexion, we're going to try to extend the knee to see if we can relieve the pain. With directional preference exercises, what we do is we start off with the least amount of load, and then we increase the force as needed. So for the knee, when we're trying to create extension, what you're going to do is you're just going to extend the knee. You're going to do that 10 times in a row, really trying to extend it with as much force as you can do. The second part of this exercise, if the first one isn't enough force, is we're going to do the same thing. We're going to extend the knee. Now we're going to take our hand and you're just going to push that knee further into extension. And then same thing, you're just going to do it 10 times in a row. The third progression of this exercise is you're going to lean against the wall, and then you're going to put most of the weight on the good side, so this side being the left side, and then we're going to extend the knee on the right side. And now we're adding a little bit of force because we're using gravity to put some load through the joint. And then same thing, you're just going to do sets of 10. The next part will be kind of similar, seated. Now you're going to add a little bit of push. The next progression is you're going to put most of the weight now on the bad side, and we're just going to extend that 10 times in a row.